Hello everyone, this is Medical Masterclass, and today we'll discuss sickle cell anemia. So this is a highly requested topic. Now let's take a look at some definitions. Sickle cell anemia is an autosomal recessive disorder, and it's relatively common in people of African origin. Let's look at some differences between sickle cell anemia, sickle cell disease, and sickle cell trait. So sickle cell anemia is when a person has the genotypes SS, has two sickle alleles. Sickle cell disease can either be SS, SC, or S beta plus thalassemia. But sickle cell trait is when the person is a carrier. That is, the person has AS genotypes. Now, sickle cell anemia has the most severe symptoms and signs of sickle cell disease. Now, let's take a look at the pathogenesis of sickle cell anemia. So, it's as a result of point mutation in the beta globin gene on chromosome 11. Hemoglobin S is formed when glutamic acid is substituted with valine, but hemoglobin C can also be formed when it's substituted with lysine, but it's valine in the case of hemoglobin S. Hemoglobin S polymerizes when deoxygenated, causing RBCs to deform, and this produce sickle cells. Now, these sickle cells lack elasticity, and as a result they adhere to the vascular endothelium and block small vessels. Let's take a look at the triggers of sickle cell anemia. We'll go through a mnemonic to help us better remember, and the mnemonic is CDIP-M. C for cold weather, because cold weather causes vasoconstriction, reducing blood flow and oxygen delivery to tissues. D for dehydration, because dehydration makes the blood more viscous and the RBCs are prone to clumping. I for infection, because infections trigger inflammatory response and increase metabolic demand. P for physical exertion, because as you exert yourself physically, there is increased oxygen demand. And M for mental stress, because stress hormones like adrenaline can lead to vasoconstriction and increased heart rate, worsening conditions like sickle cell anemia. Now let's look at the symptoms and signs of sickle cell anemia. So look at the symptoms first. Number 1, they have joint and bone pain, especially during cold conditions. There's easy fatigability, that's they easily get tired. They have dyspnea, that's difficulty in breathing, and they have spontaneous sustained erection even without sexual arousal. Let's look at the signs of sickle cell anemia. So 1 is jaundice, that's yellowing of the sclera and other mucous membranes. They have pallor, frontal bossing, natopathy, dactylitis of the hands and foot, hepatomegaly as enlargement of the liver, and splenomegaly is enlargement of the spleen. Let's take a look at the types of sickle cell crisis. We'll go through a mnemonic to help us better remember, and the mnemonic is VASHA. V for vaso-occlusive crisis, where there is occlusion of small vessels by sickle cells, causing infarction and pain. A is for acute chest syndrome, which is technically a vaso-occlusive crisis, where patients present with sudden onset of cough, difficulty in breathing, and fever. S is for splenic sequestration crisis, where there is trapping of RBCs in the spleen, leading to enlargement of the spleen. H is for hyperhemolytic crisis, where there is sudden and severe increase in the destruction of RBCs in sickle cell patients. And then A for aplastic crisis, where infection with parvovirus B19 selectively destroys erythroid precursor cells in the bone marrow. Now to investigations. We'll group them into diagnostic investigations and then supportive investigations. So for diagnostic investigations, you can do a sickling test, HB electrophoresis, HPLC, which is high performance liquid chromatography, and you can request for a blood film comment. You'll see sickle cells, Howell Jolly bodies, amongst others. For supportive investigations, you can do an FBC, which stands for full blood count, urine and blood culture and sensitivity. You can do a chest x-ray in acute chest syndrome, and you can do an x-ray of the skull, which you see the hair on end appear. Now let's take a look at the complications of sickle cell anemia. We'll group the complications into acute complications and then chronic complications. For acute complications, they can come in acute pain, acute chest syndrome, that's difficulty in breathing, and the others as we've discussed. They can come in with priapism, sustained erection without sexual arousal. They can come in acute anemia. And then TIA, standing for transient ischemic attack. For chronic complications, they can have chronic pain, stroke, that's cerebrovascular accidents, retinopathy, pulmonary embolism, renal failure, and avascular necrosis of the femoral head, as well as chronic leg ulcer. Let's look at the treatment of sickle cell anemia. We'll look at the treatment based on the types of crisis that we discussed. So for vaso-occlusive crisis, number one is good hydration. And good hydration means giving 1.5 to 2 times the maintenance fluid. Number two, pain control. So depending on the level of pain, when you rate it, if it's mild pain, you can give paracetamol. If it's moderate, you can give an NSAID like ibuprofen. If it's severe, you give morphine. Then blood transfusion, you can give packed red cells or whole blood. And also there's room for exchange transfusion as well. For hyperhemolytic crisis, you can give blood transfusion as we discussed. For sequestration crisis, the options are blood transfusion, exchange transfusion, and emergency splenectomy. Now there are some medications that we give sickle cell patients, especially in children. Yes, so you can give hydroxyurea, which helps in the production of hemoglobin F, and penicillin. Penicillin helps to protect against encapsulated bacterial infection. You can give folic acid, and then zincovite. It's been another exciting and informative lecture. Thank you for watching. If the video was helpful, consider subscribing, like the video, and share the video as well. This video is sponsored by a book in the description box, Keys to Excelling in Clinical Electives. This is Medical Masterclass. Thank you.